Go. Okay. All right. So I just want to thank you for coming today to our ABA family training for the winter here. This, as I said, this is being recorded for our families that can't make it today. My name is Carly Weaver. I have worked with children with special needs for about 14 years. And I've been at the IU for almost 9. I've spent 6 years as a special education teacher in our Rowan early intervention classroom down in Butler County. And then 5 of those were doing the ABA programming that your children are currently doing in their classrooms. I am now a behavior coach along with Rachel Ashley for our early intervention program. And more specifically, we are the internal coaches for the ABA program through Patton, which is a state-run initiative. Our job is to support our classrooms that use ABA with the implementation of the program, as well as continuing to meet Patton during consultation for the rooms that do get that level of support and be there to help support throughout the month and to make sure that all the student programs are on track for when they come back in and make suggestions. Okay, let's see. There we go. So these trainings are to give you an overview of what your child may be working on in the classroom, and kind of like the why behind the strategies that are being used with them. So today we're kind of split this training up a little bit. Rachel is going to talk about just a basic review of verbal behavior, which is the program that we run in the ABA classrooms and why we use it. And also the importance of positive reinforcement when working with children and looking for individually motivating things that they like to do. Then we have one of our speech therapists, Jamin, here to talk to you about requesting wants and needs, which is something that we call manding in our ABA classrooms. And then I'm going to, if there is time, I am going to start talking about the basics of toilet training. So things you can do at home to help your child be successful and start that potty training process if that's something that you are ready for. So I'm going to turn it over to Rachel to get started. And I think I have to advance the slides for you, Rach.
That's okay. Yeah, that's good. Thanks. All right. Just to add to what Carly had said, like, hello everyone, I'm Rachel Ashley. I'm also one of the behavior coaches in early intervention here at the IU. This is my 4th year with the IU as a behavior coach. And I've worked with students with special needs for about 11 years now in all different settings. One of those settings was for about 4 years in a school-age classroom at an approved private school. And our classroom ran verbal behavior programming just like your children are receiving in their classrooms. And as Carly already noted, I am now newly on the flip side, filling a role as an internal coach for the IU, and work very closely with Carly. All right. In our ABA classrooms or applied behavior analysis classrooms, we use a technique of behaviorism. And what this means is that we're looking at using what is motivating, what's reinforcing to your child to promote social skills, communication, learning, and academic skills, as well as self-care habits. It's based on rewarding specific behavior. So the behavior that you want to see is repeated. We specifically use, as Carly already noted as well, the verbal behavior approach in our classrooms, which means we look at different components of language to serve as building blocks. And we use this because our learners often have gaps in language that cause difficulty and affect multiple areas of learning. So we build we build up. For example, like if you can't tell someone that you're thirsty by vocally saying it, pointing, using a device, or signing, then what would you do? Well, you'd probably cry and you'd probably lay on the floor, or you'd try and get any sort of attention from someone for them to meet your needs. Or, if you couldn't let a peer know that you wanted to turn with a toy or you wanted to play with them, you might hit them. Um, We need to help our children using the ABA verbal behavior practices to respond to what we're asking them to do, to imitate our motor imitations, and respond to questions to keep them safe. So, what is our goal? Sorry, one second. My screen doesn't scroll. There we go. I made it too zoomed out. There we go. So what are our goal? We use motivation, reinforcement, and a variety of other procedures to teach the verbal operants, which is what we're going to review. We talked about this in our October training, but or the stepping stones, to build that foundation, to fill our learners' gaps in their verbal behavior, which then helps to increase their success across multiple settings, different environments with different people. Okay, next slide. Okay, so this is just a list of the verbal operants. I'll just go over them briefly again. We talked about them in a previous training, but Carly mentioned manding, which Jamin's going to talk about in a lot of detail in a little bit. But manding is a request made by having motivation for an item. So, for example, you see your coworker is eating a donut. So you say, I want a donut, and most likely, hopefully, there are more donuts for you to have. Tact, which is labeling, and it's labeling something that you aren't necessarily motivated by, but you, for example, you see your coworker with a donut and you say, "Oh, you have a donut today." Echoic, which is vocal copying, and that's repeating after a speaker. So repeating an order that your coworker gives you for a donut shop. Maybe they tell you, I'd like a strawberry donut with sprinkles. And so when you get to the counter, you echo that and you repeat um, what they would like. Motor imitation is motor copying. So you're imitating the movements of others. Introverbal is something someone says something and you say something different or you fill in the blank. This is often seen with songs. You can pause at the end of a song and someone might finish the song. But you could also say, "Where did you get these donuts?" And they might say Dunkin'. Um, and the last one there is listener responding. So we're responding to someone else's demand or request by following directions. Um, so maybe when someone says, "Pass the napkins, please," you follow those directions and you pass them a napkin. All right, next slide, please. All right, so that was a real quick review of those. If you're interested in more on those, we can share that training again. It has breaks down them all and gives visual examples of those too. So we can, if you're interested, we can always resend that out. Um, in the last training, we also talked about reinforcement. Reinforcement is something that happens that increases the chance of a behavior to happen again. In order to effectively teach a new skill to anyone or have them do work for you, you have to determine what's reinforcing to them. A really great example is many people would not be working a daily job if they didn't get a reward, which is being paid. We're reinforced by getting our paycheck to continue to do our job. We all love our jobs, though. It can also be as simple as me talking to a friend and then her laughing at what I'm saying, so I continue on with the story. If she wasn't laughing or giving me that social reinforcement, I may stop my behavior of talking or change the subject or, work on something else. Thank you. I have it covered up. All right. Um, why is positive reinforcement so important? We rely heavily on in our EI classrooms as to what is reinforcing to your child. Looking at motivating items, food, activities, songs, interactions. When we can find what is reinforcing, we're able to increase the likelihood of changing a behavior through the availability of a reinforcer. So positive reinforcement is so important. It because it increases the frequency of a desired behavior. It increases self-esteem and self-confidence, improves social skills by the student getting positive feedback for their interaction and or focus, attention to remain on tasks so that they earn the reinforcer. It improves focus and attention to remain on task, which I just said, and it overall facilitates learning. We pair ourselves with the preferred items by delivering the reinforcement so that the students are more likely to want to come to do fun things with us. If, someone just has a pen, a pencil, and a paper to do work, but the other person has bubbles and they have maybe a ball to sit on to bounce while they're working, that's where the fun is. That's where they want to go and do the work. This leads to eventually us being reinforcing over the object. So we're pairing those things with us as the deliverer, and then soon they just see us, and that's reinforcing, which is always such a cool thing to see in the classrooms that they know that we are the carrier, the keeper of the good things and the fun things. Um, let's see here. And like I said, these are all a review from what we talked about in October. But one of our very important topics today, something that is easy to do at home, which Carly touched on, is manding or requesting things, teaching your child to request things. Um, and like I said before, we can resend any of that information as a deeper dive in the review if you're interested. But I'm going to hand it over to Jamin, and he is a speech therapist here at the IU in Mercer County. And one of the greatest things is to have this collaboration with speech therapists. It's like a great team that is in the classrooms and to see all different services work together for the same goals for your children. So I'm going to turn it over to Jamin for manding.
All right, thank you, Rachel. So, like she said, my name is Jamie Wentling, and I'm a speech therapist here at the IU. This is my second year working in our ABA classes. So I work in an early intervention classroom that's located at Farrell, and I also work in a school age classroom that we have at Farrell as well. So it's cool to see students along the timeline of watching them grow from an early learner to a school age kid. So in the classrooms that I work in, I primarily take the lead on the students' manning programs. So I know in past family trainings that Carly and Rachel have had, they express the importance of manding, and I just want to continue to piggyback off of them and talk about why it's important and why we do it. So in the slide I have here, I have some questions that we're going to kind of explore in the next couple slides, and hopefully we can make some sense out of Manning, talk about what it is and what it looks like, and then again, why it's important and why we want to focus on it in our classrooms. All right, so generally, the main goal of Manning is so that we can make our wants. The more fancy definition is that it's a general term for asking, requesting, or commanding. So you can command or demand. That's kind of the big word that we get manding from. In the classroom, the team teaches our students in these socially appropriate ways how to gain access to something that is motivating to them in their environment. So we use different forms of communication, to get what they want, and those are what we call response forms. So to introduce response forms or those options of communication, I kind of came up with a little story that hopefully makes it relatable to adults. So if we think about going on a journey, or if we think about going on vacation, the destination is our main goal. So that's what we want, is that destination. So if I'm tired of the Pennsylvania winters, I might book a trip to Florida for a week so I can feel the sun and I can feel warm temperatures. So that's the thing that's really motivating to me, is being in the sun and being warm. The response form is how I get to Florida. So that's how I get what I want. So in my case, if I want to get to Florida really quickly, or really badly, I might buy a plane ticket. because that's going to get me there the fastest way. But if I wanted to also get to Florida, I could drive down or I could walk or take a bus. Those are all going to get me there, but buying the plane ticket is the fastest way of getting me there. So, in teaching our students how to make their wants and needs known, we're also able to teach them skills that are at the core of social communication. And these skills are response forms or options of communication that we can use to get what we want. And we're going to talk about those in the next couple slides. So, generally, how do our students mand? So, they use a variety of these response forms that I just introduced to get what they want. And we use them as building blocks, and they're also very key to social behavior and social engagement. So, the most seamless transaction between getting what we want is using vocal language. Like we talked about an example earlier, similarly, I'm going to say, if I want a drink, I'm going to look over to my teacher and say, hey, I'm thirsty. Can I have a drink? But sometimes for our students, using their voice is not as easy for them as it is for us. And that's a skill that we have to work up to. But each student is different and we have to meet them where we are. Some examples of these response forms that I introduced are pointing and leading, gesturing, icon selection, eye contact or looking at an individual, basic sign approximation, using the whole word or using an approximation of the word, and more. So these response forms that we just introduced, they're very key. And most times we're in a social interaction, we use more than one of these response forms and we don't really realize that we're doing it. And they tend to build off one another as well. Okay, thank you. So before I give some examples of how we target these in the classroom and what it really looks like as we peel back the layer, I kind of wanted to provide some insight as to why we focus on them, because all these pieces of social interaction, they play a role in allowing us to get what we want. So the students in our class are not the only ones that use these response forms. Adults use them in the same social intricacies. So here's another silly story. So for an example of leaning in or reaching in, when you greet somebody for the first time, oftentimes one person is going to offer their hand to the other person for a handshake. You don't really have to tell somebody to shake my hand. You just do it because that's something that, our culture has grown accustomed to, is that when I stick out my hand to introduce myself, somebody just shakes my hand. So that's what we would describe as leaning in or reaching in. So an example of looking at somebody or eye contact as a form of manding is we're going to go back to the same example. So during that same social interaction, when you're greeting somebody, it's also a custom of ours to look at the individual and say, hi, my name is Jamin. So when we engage in these social interactions with other people, we're also looking at them. To provide an example for gesturing, pointing, or leading, so let's say these two strangers that they just introduced each other. The reason they're actually getting together was that they're going to have lunch and discuss a business proposal. So now they introduce themselves and they're trying to decide on a restaurant. The one man says to the other, where are you thinking for lunch? And without saying anything, the second man just points at a restaurant down the road. So the second man didn't really have to say anything. I mean, usually somebody would say, yeah, I want to go eat down here. But he was able to use that gesture or that point to make it really specific of, I want to go to McDonald's because that's where I pointed to. Even though McDonald's might be an odd place for a business meeting, that must have been on my mind when I was making this example. So while the men are at the restaurant, there are multiple other social intricacies that are taking place that the average person we might not really think about doing just because they come so second nature to us. So, for an example, a gestural man would be if an employee completes the orders for these guys, they go up to the counter and they put their order in. They make the order, and the men go to the back of the room as they wait. So the employee's coming up to the microphone and they say, "Order number 55, your meal is ready." But since it's lunchtime, the men are in the back and it's a really noisy, crowded room. So without walking all the way up to the front counter, the one guy might either raise his hand or make eye contact with the employee and maybe put his hand up to his ear to, as to say, "Can you say that again? I didn't hear you." So that would be a gestural man that we would talk about. So while we're at McDonald's still, an example of a picture exchange would be if the man was paying and he had a coupon and he just handed that coupon to the employee, we could consider that a form of picture exchange. And we're going to talk about that as well um, in a couple slides. And the last one is the one that we might think of most commonly is using our voice, is that verbal man that we are all eventually working up to. And that's when somebody's saying, "Hey, I would like the number 5 with a large Coke." So that's what we think of most commonly. But all of this to say is that, adults use these components of social communication as well. So that's why we really focus on teaching them. And over the next couple slides, we're going to take a look at how we work on these aspects of social communication in our classrooms. So before we play the video, I'm going to kind of lay it out. Here we have an example of using eye contact or looking at somebody as a form of manding. So in this video, the instructor has already established that he and this student, they really like engaging in this highly reinforcing activity, which is them singing this song. So he begins to sing the song. He's going to get the student engaged, motivated, and then we're going to see him pause, and he's going to wait for that to regain eye contact or to re-engage by looking at the teacher. And then when we see him do this, he's going to keep singing the song. So this is how we would begin to teach looking at another person as a positive, and how it's a social skill that we want to continue to work on. You can go ahead and play it, Carly.
Four little monkeys jumping on the bed. One fell off and bumped his head. Mom called the doctor and the doctor said, "No more monkeys jumping on the bed." Three little monkeys jumping on the bed. One fell off and bumped his head. Mama called the doctor and the doctor said, "No more monkeys jumping on the bed." Hey!
Jump, 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 jump.
So we kind of see him trying to, let her know by pausing and, creating some maybe awkward silence, like, "Hey, oh, there, let's keep singing the song again together." So in the next part of this video, we see a student and an instructor on a trampoline, and the instructor might look familiar. And the instructor is giving the student some free trials, is what I like to say. That she's giving the student some free trials, building his motivation and getting him interested in jumping on the trampoline. But then she stops. So in that stop, she's teaching him that, that eye contact or looking at her as the teacher is a good thing. And she's going to wait until he looks at her again and kind of reaches towards her before she continues the fun jumping on the trampoline. So the student also, this is an example of how she would be able to work on looking at an individual and reaching towards an individual all in one session. So this is an awesome example how the students really motivated and our instructor is able to work on a couple different things all at once. Thank you. So in the trampoline example, you're able to see a couple of the things that are working on a deeper level, and that's, when that student engages with Carly, she's instantly providing feedback or in reinforcement to that student. And on top of that, when the student has a really good attempt to communicate with her, she's also providing differential reinforcement, which means when he does this really good performance, she's making that trampoline so much more fun. She's jumping longer and higher to show the student that you did really well, and this is your really good reward for doing that. We can go to the next slide now. Thank you. So in this example, we have this is a specific example of me working on reaching in or leaning in for a student to initiate a man for a fun activity. We also call them social chains, but we're able to see him engaging in social engagement for this really fun activity that he wants. So in this, we've already established the fact that this student, he really likes to sway with me as we sing Row, Row, Row Your Boat. So he knows when we sing this song that we do this specific motion that is really fun for him. So in this, I'm trying to teach him that he needs to approach me if he wants to get if he wants to get what he wants, he needs to be approaching me. So these are the small but crucial pieces of communication that we are using. You can go ahead and play that, Carly.
Row, row, row the boat gently down the stream.
Sorry, I had to use short videos. I was having a tough time downloading, but at the beginning of that, the student comes up and you can almost see him kind of begin to lean and begin to sway back as he's reaching out to me. And in that, I'm trying to provide immediate reinforcement by, you did a great job of coming up to me, and we get to sing our fun song now because you created this social engagement with me. And one of the reasons that I really like teaching reaching in and leaning in specifically is that this is where we start to see our students approaching others, approaching adults, family members, and peers in socially appropriate ways. And we start to see them kind of break down that wall between themselves and other people. We're good to go to the next one then. So here we have an example of picture exchange or icon selection. So with this student, we've already established that he really likes cheese puffs. And that's what we're working towards him requesting is cheese puffs. So when he gives me the picture of a cheese puff, I try to provide that immediate reinforcement like we talked about. But I'm also narrating. I'm saying cheese puff when I deliver the cheese puff to him. So he gives me the picture. I give him a cheese puff, but I'm telling him cheese puff so that I'm building the skill that he knows that this is a cheese puff and this is what it looks like. And like I said, um, immediate reinforcement is another um, piece of this that we try to do it as often as we can because that's going to increase the future likelihood of him doing that. If he sees I have that cheese puff in my hand, I'm ready to give it to him, and he knows all I have to do is pick up that card. He's going to be more likely in the future to pick up that card to communicate with me. If he knows that, pretty shortly afterwards, after I give him that picture, I'm going to get something that I'm hungry for.
Cheese puffs.
Nice, Tommy.
My immediate reinforcement could have been a little quicker. I could have had the picture of, or I could have had the cheese puffs in hand, but I think he was really, we already had some good engagement build up, so I think I'm going to cut myself some slack. All right, I'm ready for the next slide. Thank you. So here we're going to look at using gestures or basic sign approximations like we talked about in our example. Um, so you're going to notice a common theme, you know, everything that every time that we're asking a student to do something, you know, as far as manding is concerned, we have it in the back of our mind that this student already really likes this activity. That means he's going to be more likely to um, communicate with me to get access to that activity. So we have a student here we're working on using gestures and basic signs to man for a highly preferred activity. So we've already established the fact that he really likes head squeezes. So I've taught him a basic sign for head squeeze, which is him taking his hands and kind of making like a squeezing gesture. In this way, we're also giving him some independence that, you know, he doesn't have to rely on anything else other than, he approaches me, he engages with me, and he gives me the sign for a head squeeze. He knows that, he's going to get a head squeeze. So we're also promoting some independence. So you can go ahead and play that first video.
Squeeze. Cheese puffs. Cheese puffs.
And so I know it's short, but he gives that sign for a head squeeze, and I promise it wasn't as fast. And um, I go in, give him the head squeeze, and he really, you can start to see him afterwards. He was like rocking back and forth, kind of letting everybody know that okay, I had a good time with a head squeeze. I also see that I have access to cheese puffs. So in the next video, it's also just another request for him for cheese puffs. Shake, shake, shake it, shake, squeeze, squeeze. So I was mistaken. This was a video about shakes. So as we work up to, having him just put his hands up and make the sign for a squeeze is sometimes not where we start, because we're trying to teach skills to students that, is really novel to them. So we might have to start somewhere that's easier for them to grasp. So in this video, I kind of put my hands in this motion, like I'm presenting the item, but I'm not doing the actual action of shake. I'm just letting them know, like when I do my hands like this, we shake. And so you can see him put his hands up, and he's the one that's actually initiating the sign for shake. And I believe we also uh, he's also able to request for cheese puffs in that as well. Okay, I'm ready for the next. So in this video, we're looking at those basic signs that we just looked at, but we're also going to hear some vocal behavior from the student. So this is kind of the progression from signs we're continuing to narrate as we're delivering the reinforcement. And then we're also going to start to see some vocal behavior from the student, which is ultimately our goal. So I included the first video as an example of me building motivation for an item. So, this is another common trend, we need motivation. If we were really motivated by a toy or activity, we're probably going to be really motivated to ask for that item so we can gain access to the item. This is crucial when we're teaching banding. I'm not going to really enjoy learning how to speak French if I don't really have any motivation to speak French. So we can go ahead with the first video.
Butterfly? Sure. Ready? Yeah. Yes.
So we have this terrifying cat, and it's this cat. It's an item that the student really enjoys, and um, he's able to man for it, and we'll see in the next video. But in this video, it's really like Rachel was talking about. We want our objects to be reinforcing, but ultimately we want to be the most reinforcing thing to the student, so we can work on our session skills and work on cooperation. Um, but taking this silly cat with chattering teeth, and kind of making it more fun, making it something that the student really, he gets a kick out of, pretending that the cat bites him, or, kind of holding it up in the air. And then we're going to see in the second video, him requesting for the item.
Ready? Set?
Cat. Cat.
So you're going to see, you see that narrating again as I'm delivering the item. But what you might not have been able to hear is that when he's making the sign for cat, he is also saying cat. And it's not as quiet or it's not as loud, but that is ultimately our goal, is that he's making the sign, but he's also saying cat, which is getting us that one step closer to allowing him independence to use his voice to make his wants and needs known. So on a day-to-day, how does this impact the programming of our students? So we implement Manning throughout the day. Students are working, they're experiencing, different adults all day, every day. So in the classroom, when we're working on this skill, we work with all adults in the classroom. And we also try to work on this across different settings and different times throughout the day. Because when we teach our students demand, we don't want it to just be in my session from 10 to 10:30 when I'm working with a student is the only time that he's working on this skill. So an example of how we kind of teach this throughout the day is that, if I know a student really likes cheese balls, during my session, maybe I'm going to teach him like this specific way how I think, or how they can communicate that they want cheese balls. But, during snack time or during breakfast, maybe when they're hungry throughout the day, we're also going to target that, we need you to be able to tell me that, I want cheese balls, and here's the way that you do that. So that's also an opportunity for them to practice throughout the day and to other people. So that's a very, very important thing that we like to emphasize as well. So to kind of wrap up Manning, is that if there's one thing that is the most important piece of Manning, is that it's a behavioral cusp. And a behavioral cusp, it's a socially significant change that allows an individual to access a new environment or new contingencies or new reinforcers. So it's this catalyst for further growth for the student, for further growth and development. And it also is going to make a big impact on the people around the individual. So when we develop skills for Manning for our students, we are creating this stepping stone. So if anybody is looking for any ideas or how to do this at home, um, I really encourage you to talk to your classroom speech therapist um, about, what are some ways that you can do this at home. And Carly and Rachel provide great resources for us on, here's some new ways that we can target this skill and how we can get some transition between um, the classroom setting to home, because ultimately we want them to do it in class and at home, um, so we can see some great development.
Thanks, Jamin. Thanks for joining us today. That was really great information. And this will be recorded, but like Jamin said, email your classroom team if you are looking for strategies specifically about how to incorporate manding or requesting at home. Your classroom team will be a wealth of knowledge for you as to how to kind of set that up. Make materials for you if you're looking to do some picture exchange and things like that. So we are going to let Jamin go because he is seeing kids today. But we really appreciate you hopping on, Jamin.
No problem. Thank you guys.
Thank you. All right. So we are going to dive a little bit into toilet training. It's something that the last couple kind of winter seasons we've looked at. I think number one, it's sometimes it's a nice time. People are at home a lot more, kind of hanging out in their house. So you have a little bit more time to start something like this. And then also we start talking about kindergarten transition. And a lot of families, when their child is starting the process of going through kindergarten transition, they get very anxious about toilet training. So we kind of just want to talk through that, talk about some strategies that you can incorporate at home, some kind of just facts about toilet training, and also like what to expect when you get to kindergarten as far as toilet training goes. So this is kind of just like a brief overview, but I do embed in this PowerPoint some other more in-depth discussions about toilet training as well that come from like the state level, the Autism Initiative. So those can be helpful as well as some books and some other resources, some visuals that your classroom teacher can make for you to kind of initiate that potty training. So just some like basic facts to kick us off here. Most children, they start showing interest in toilet training anywhere from 2.5 to 3 years of age and are, statistically fully potty trained by the age of 4. But this is on average. This is for children that have no developmental delays or other contributing factors that we're kind of looking at. So it's very important to keep that in mind when you're working through your child with this process because it's a lot more complex than just going to the bathroom on the toilet. It can be hard and frustrating with a lot of ups and downs, both for parents and for the child. So these are just some things to keep in mind as we talk about this. Often, like we're talking about motivation and reinforcement, children need some type of behavior incentive for using the bathroom to successfully be toilet trained. Um, so it can be scary for them if they are typically developing or if they do have some kind of delay. Both may need some kind of incentive. I have some examples too about toilet training my own son and how difficult that was, and needing some incentives along the way to kind of get that process going. So the toilet training book that is on here, it's Toilet Training in Less Than a Day. It is a more of an ABA or a behavioral approach to toilet training, and that is the book that Patton actually suggests. It's actually more than 30 years old, and they still find it very relevant and effective for teaching your children the basics of potty training. Okay, so I am not saying that training is easy. This is definitely a process for the students that we work with. It is something that we encourage families to kind of like get ready for. It's definitely something that has to be intentional and it has to be consistent. And then often we need to kind of think about some like behavioral interventions that we may need to tie in as well. Some kids need more explicit, like this is how you do it, step by step, specific training than others. Every child is different, and what works for Rachel when she's potty training her children did not work for mine. So you really need to kind of go at your own pace and figure out what works for you and your family and your kids. My son was able to pee on the potty from a pretty early age, but he was not fully potty trained and was requesting a diaper to poop for a long time. So there were all kind of hurdles in that, and it is a very like intense and kind of real experience that you have to keep it positive. And you kind of have to wait too, sometimes until they're ready, but also then hold them accountable with some behavior interventions to, incentivize like this is a good skill to have. This we can make this fun, and it does increase that independence. So here are just some reasons that we can focus on toilet training. I do want to start out with that being potty trained is not a prerequisite for going to kindergarten. Your school district that you're transitioning to will come up with a plan to help you and help them toilet train your child at school, as well as you carrying it over at home. But that is not something that any of our districts say they have to be toilet trained to come to kindergarten. So I just wanted to kind of put that out there. Everyone comes in at a different level, and the district has to be ready for your child to start kindergarten. You don't need to get them ready, to go. So there are a few things that are kind of important though as they are moving through school. If you are able to start toilet training, these are some kind of like benefits. It's definitely something that can increase the time that a child is in a more inclusive setting. If they are not in a diaper, then they're not needing to go back to a different room to then be changed, so that it does increase that time in inclusion. It decreases social isolation as the kids get older. It's less socially acceptable for them to still be in a diaper. So getting them out of that phase, as they're entering school age is something that is important. It gives you the ability to take your child more places if they are toilet trained, and you can use the toilet at Target and Costco and all of those places, and kind of get them used to all of those environments when going to the bathroom. It also, long term increases access to more transitional programs, different careers as, you go into adulthood, and then, increasing independence, generally speaking, both as a child and then as they transition and they grow up. So, there are behavioral challenges, considerations that, can make toilet training hard. Communication, like we're talking about with Jamin, if there's a breakdown in that communication, or we have some other cognitive delays that they aren't really able to recognize, that they feel like they need to go to the bathroom, they can't communicate that, that can be definitely a barrier. Other health concerns that we always encourage people to rule out would be any kind of like digestive or bowel issue. Nutrition and diet is a huge factor too, and can be a concern when toilet training. Um, it's hard because it's hard to stay consistent. You want to go to grandma's house and you have a 2-hour car drive and things like that. So really, we're going to talk about how you can kind of set yourself up for success with being consistent here in the next few slides. And sometimes it's hard because they just aren't ready. My son was ready to pee in the toilet. He was not ready to poop, and forcing it was causing way more drama in everyone's life. Than needed to be. So giving him time and trialing it and then kind of pulling back a little bit was the best thing for our family. So you kind of just have to set your goals on your family and your children and try not to compare yourself to others when you're going through this process. Okay, so there are a bunch of prerequisites to kind of consider when kind of trying to determine if your child is ready. The first one would be a sign of bladder control. So, this may just start naturally, which it oftentimes does. You kind of notice that you're not changing wet diapers as often. They're able to stay dry for longer periods of time. Maybe they're dry overnight or during a nap time. So you kind of have that sense of the bladder control that is starting. So you also have to think about like their physical readiness. Are they able to use the bathroom with some type of independence? Um, so that is just that self-initiation to go. If there's some kind of barrier, if they're kind of smaller and they have trouble hopping up on the toilet, do you get the step stool potty seat that goes on there? If that's too much for them, getting the little toilets that you can kind of set around your house, things like that. A lot of kids feel much more comfortable when their feet are on the floor when they first start potty training. So you kind of just have to look at that physical readiness and what your child's physical abilities are as you're like setting up your space. So they also have to be able to follow some adult directions. So, if there's still a lot of children need prompting through the potty training process. But you want some compliance with activities, them being able to, if you're saying we're going to try this, that they're not having a full-on meltdown, crying, running away, things like that. Which we'll talk about incorporating motivation into it too to make it more fun for them to be in the bathroom. And then you do, like I said before, you want to look of clearing them of any medical concerns. You can ask your child's primary care physician if, they have any concerns. I'm sure you would know if there was kind of something digestive, like gut related, that was going on that would inhibit that, or, you just want to make sure that you're cleared before you are kind of insisting on them using the bathroom. It's just an important step in this process. Okay, so this is just very basic information. Like I said, this is very individualized for all children. So this is not going to look the same for everybody, but this is something through Patton that I've learned and kind of like a behavioral look at toilet training. And it's something that they suggest as well. So when you're ready and you've been cleared by a doctor to say, yep, you have no barriers as far as that goes, your child is able to kind of follow some simple directions like come here, sit down, um, things like that, then you can look at your schedule and you want to try and find a 2 week period to dedicate to toilet training. So they kind of suggest this 2 week plan and really scheduling a meeting or phone calls or whoever is involved in that child's life. This is what we're doing for the next 2 weeks, whether that's childcare, a babysitter that comes to the house, grandma and grandpa, the school team. It's very helpful for us when you're sending your child into the classroom, like, hey, we're working on toilet training. We've done lots of things in my own classroom where they start toilet training and they may ride the bus in a diaper, but as soon as they get to school we put them in underwear and we kind of go on a schedule. So it's something you want to make sure the whole team is aware of, and that you're kind of taking this on and when you're doing that. You also kind of want to look at the effects on your child's schedule. So discuss how you might be limiting other demands during the day. I would never focus on toilet training if you're also trying to like incorporate new foods. Like if you're doing some kind of intensive food therapy or something like that, I wouldn't pair toilet training on top of it. You kind of want the rest of your child's life to be status quo. And you're not adding too many things in that is going to kind of stress them out. Um, this could be something too that you can ask friends or neighbors or family members, like, hey, we're going to do this weekend. Is there any way younger siblings can come hang out with you for a little while? Maybe organizing, having people kind of organizing or prepping meals for you. So you're really focused on this task, and you want to implement, this protocol with consistency for about 2 weeks. So you just want to minimize, any distractions. Also minimizing time outside of the home, especially on those weekends. Like we still want your child to come to school and come to programming. But maybe going out to dinner that week or and that's the example of if your child, if another sibling has soccer practice, seeing if maybe you can get them a ride to soccer so that you can kind of stay home and hone in on toilet training. I realize these are all ideal situations and they're just suggestions to think about, and it's very hard to implement all of them. They're just some things to consider when you're really looking at like intensive potty training at your house. You also want to do some kind of form of data collection. It can just be on like a piece of paper. Most of us moms and dads and caretakers families know that when our child usually needs to go to the bathroom. Peeing is a little bit different, but sometimes children have a pretty scheduled time that they go poop. So you want to kind of mark that down and be able to track that for a week or two ahead of time so that you can communicate that to others, and that so you can also work on, every day at 2 o'clock seems like he needs to go to the bathroom. We're going to put him on the toilet at 1:55 or something like that. You also want to look at just kind of jotting down some preferences that your child has, and you also want to look for like one big golden ticket item. For my child, it was drinking a Coke. A little can of Coke sat in our fridge for like 3 weeks until he pooped on the potty. So that was my golden ticket item. A lot of our kids rely heavily on technology. You can have technology be a golden ticket item, a favorite snack, something that they don't typically get, or something that you are willing to kind of withhold for a little bit. Of time while you're in this process of toilet training. It can make it a lot easier. You also want to prepare the room. I wish I had pictures of a few of our classroom bathrooms. It's like impressive what the teams have done with the bathrooms to make them more exciting and less scary because they're outside of their home. But preparing the bathroom with like some fun visuals in there. We have a EI classroom that has Lightning McQueen all over the bathroom because we had a little boy we were really trying to work on toilet training with. You also really want to make sure the room is able to be clean, or like you're able to clean it easily. I wouldn't like start potty training necessarily on a carpet. Putting towels down may be helpful too, just so you're able to like sanitize that area quickly, and try. It's not like a big deal if your child gets something on the carpet. You don't want to make them feel upset or ashamed that that happened. So being able to just kind of quickly clean it up and dispose of it and kind of minimize that attention to that is something that they recommend. Another consideration, I know there's a lot of considerations here, but I hope this is helpful. Looking at the clothing that they're wearing, making sure they're comfortable. It is hard for our kids a lot of times with jeans on. So if you are able to put them in sweatpants that are loose, that you're able to kind of pull up and down quickly, easily, that they're able to do or help with as well. Also consider things like Crocs, flip-flops, things like that, so that if something does get on their shoes, that you're able to clean it again and not make a big deal about it. Something else to prep if you're getting really serious about this is doing overnight diapers only. So getting rid or hiding other diapers. Our kids are super smart. They know where their diapers are and they will go find it and they'll ask you to put it on however they ask, or they'll try to put it on themselves to go in the diaper. So you really want to consider maybe hiding those things except for overnight periods. Again, this is not easy, but it is looking at providing overall better life outcomes, for what could be a 2 week process. Um, it's a short period of time in the grand scheme of things if you're really able to dedicate that time to process or to doing this training. Um, we talked a little bit about identifying what they will kind of do anything for, really finding that motivating item. Food is a good idea because often you can't take it away, so you can only give it. Sometimes, like if you are using like an iPad or something like that, can be hard to take it back. So something that kind of like disappears or they eat, that can be helpful. Um, I'm trying to think what else. You can also do promise reinforcers too. If your child is cognitively able to kind of understand, if I pee on the potty, I get to go to McDonald's. If I poop on the potty, I get to go get an orange slushie that I never go get. You can kind of incentivize that way too, if that's something that your child is able to understand. So this is phase one, which is bladder training, which we're going is definitely a little more straightforward than toilet training. Um, so the biggest thing here is as soon as your child wakes up, you're going to change them into underwear. Of course, you would try to have them go to the bathroom as soon as they wake up. You would have them sit on the toilet. But as I said, there is a barrier to diapers because the diapers that we have now, our kids actually don't feel wet. So that it's not wet on their skin because they're so absorbent. So it's difficult for them to even recognize that they're wet. So getting that diaper off right away and putting underwear on is your first step. Keeping your child full of liquids. So over that 2 week period, you may have a lot more chocolate milk in your house than you typically would. And that's okay. It's a short period of time that then you can fade the chocolate milk and get it back out of the house. But if that's what they like to drink, you really want to push 4 to 8 ounces of that drink every 30 minutes. You really want to like increase the number of times that they are going to the bathroom during the day. Using a special drink or a special cup may help get those liquids in faster. You're going to try taking your child to the bathroom every 30 minutes, and you're going to pick a consistent phrase to share with them. So, time to use the potty, whatever you come up with, you want to stick with the same phrase every time. And you want to use an excited voice, like it's time to go to the potty, let's go, something fun, just to get them excited about going. And then you're going to support your child through the transition and the routine while learning. So you're really going to actually limit your verbal, what you're saying to them, and you're just going to kind of support and guide. You can use small words like sit, stand up, things like that. But other than that, you're going to kind of just not say anything. So the goal is independence. So fading that verbal is much harder than fading a physical prompt. So that's why you're going to limit those verbals. You also really, this is something that you really have to catch yourself because you get really excited. When they do start to go, you do not want to say anything until they've fully gone to the bathroom because sometimes that praise like gets them excited and then they actually start going and they don't eliminate or void fully. So you just kind of stop and wait. Don't provide like a lot of excitement. As soon as you know they've fully gone to the bathroom, then you're going to have a huge party for them. And then you want to help the least amount you can, prompting to pull up pants. That's something, it's individual to your child. So, to me, that would be something that would come a little bit later. And if they need help pulling up, especially with our early intervention students, that motor planning sometimes is difficult. So making sure they have loose clothing on, that's a little bit easier for them is much more beneficial. All those other bathroom skills will come later. If they struggle, like you don't need to turn the lights on and off. You can prompt them through hand washing. Those kinds of things, like don't worry about that. We're just worried right now about peeing on the toilet.
Can I add something real quick, Carly?
Yeah, go
Just
ahead.
from just from personal experience, one thing that worked for my son was when I would say time for potty, it actually was like a trigger to him.
Mm.
So I tried to change it up a little bit, and we actually made it a game where we were racing to the bathroom. So we would, because it was a whole Lightning McQueen obsession at the time. So it was a race to who could get, in the hallway first or to the door first, which then set him up, if he won,
Mhm.
which I let him win all the time, he let him get there first, and then he would get in there, and it was kind of on his terms. It was like he was in control of it. So that helps too, if you ever face that where when you hear those words or maybe you see a visual and that might, be hard. Maybe it's not exactly the toilet or the words time to potty. Maybe it's a, picture of McQueen and you take him to the bathroom with you, or things like that. So it can be a little out of the box as well. I just wanted to add that in there.
Yeah, that's a good point. Um, Yeah, I like that. Yeah, it's not the same for everybody. So figuring out what works for you and if the racing game works every time, then just keeping that consistent and like that's the important part. Um, Another thing is like I say, they'll sit down, they'll go to the bathroom. So that doesn't always happen. So this protocol actually suggests that you have your child sit on the toilet for 20 minutes. So this is the hard part, and this is what takes a lot of time. So the extra time actually allows your child to learn that bladder control, and you're giving them time to eliminate even more than once. So that's why you want to make it fun in there. If you want to take books in, something for them to do. If like you're not using an iPad or something as their golden ticket item, and you want to have them use your iPad and interact with them with them while they're sitting, that's totally fine. So you can turn on and off those reinforcers when they're sitting versus when they're going. You want to give them extra praise when after they've gone to the bathroom, but you are reinforcing just them sitting. That's a huge first step for them to feel comfortable enough to sit on the toilet. You just don't want to use that best reinforcer while you're hanging out in the bathroom, if that makes sense. So again, you would observe your child closely and you'd reward appropriately. If they start to pee, you want to wait and do not praise until they're fully done. And then after that 20-minute kind of mark, if they don't go to the bathroom, you're going to continue to look at that dry check, do a dry check every 5 minutes. So this is all things considered if your child's drinking all that liquid, right? Because like if they're not drinking 4 to 8 ounces every 30 minutes, you're gonna have a harder time. They don't have to go to the bathroom. They don't feel like they do. So you may need to adjust these times to like fit your schedule a little bit more based on how much they're drinking. But if they were drinking the 4 to 8 ounces every 30 minutes, they didn't go after the 20 minutes in the bathroom. Every 5 minutes, you would check them to make sure that they're dry. And they're in underwear at this point. You want to kind of make sure they're in view too, because some of our kids will leave and they'll go like behind the couch and they'll go to the bathroom there, do something like that. So you kind of want to make sure that's why you want to limit distractions, and it's kind of like all hands on deck, all eyes on your child during this time period to make sure that we're getting them to the bathroom um, as soon as we can. So you're gonna follow this positive practice too, which I'm gonna get into. Um, you're gonna go through this toileting routine 3 to 5 times. So this is if they are not dry when you've taken them, when you did your dry check. If somehow you missed it, if they did end up going to the bathroom in their underwear, you're gonna do this thing. It's called positive practice. So you're gonna say something along the lines of, "You're wet, you go pee in the potty." Um, And then you go through this routine of prompting them fully to go into the bathroom, pants down. You would sit back on the toilet. And it's called an overcorrection, which helps to build that routine of, oh, I'm wet. I needed to go to the bathroom. I needed to get in there. And you're not rewarding this behavior. You're not disciplining them either. It's kind of just a very neutral, matter of fact conversation that you're having. The book that I suggested in the beginning talks about keeping wet clothes on the child for the initial training so that they feel that just while you're doing that overcorrection phase. This is not something that typically we can carry over in the school just for sanitary reasons and also the dignity of your child. We don't want them to be wet in the classroom or feel any type of embarrassment. So if you do read that book, that's not something, that positive practice is not something that we would carry over as far as keeping them in wet or soiled clothing. But that is something that you could practice at home just while you're doing that overcorrection process so that they recognize again, oh, I am wet. My underwear are wet. I don't like that feeling. Um, and again, that's not something you would necessarily do for a bowel movement either. But in the privacy of your own home, that's what the book does suggest to work on that overcorrection procedure. Okay, so this is just some potential barriers. I'm going to go over this quickly. And then we'll probably have a few minutes to touch on bowel training. So we have kids that are holders, so they don't have many accidents, but they also don't go to the bathroom very often. So that's why really, pushing those fluids is really important so that we're encouraging them to go to the bathroom more frequently. You do want to just stick with it. You do not want to reintroduce diapers or pull-ups. Increase incentives in that fluid intake. I did not need a golden ticket item for my son to pee on the potty. I only needed it for him to poop on the toilet. So, I had to really increase my incentives once we got to that step because he was resistant to it. And then go big on the reward after their first success on the bathroom if you have a child that tends to like hold their pee in. Um, the other potential barrier would be the child, we calling it the eliminator in the book. So he's having frequent accidents, even though they are going on the toilet as well. So you really want to make sure, and that's where that 20-minute window comes in because it actually allows them to go to the bathroom more than once. But you're really making sure they're emptying completely on the toilet. You're not praising too quickly. And you're really rewarding for like a um, longer urination, versus just a little bit coming out. So eliminate rewards after an accident. You do not, even if they pee on the toilet after an accident, they would not get a reward. And this would be only if you found that over like, okay, the first week, this is what we're seeing. We're seeing this potential barrier of the eliminator. And now we are going to stop rewarding if they were wet first. You would also shorten that time in between them sitting. And then you have to kind of think like, hey, is there something distracting? Like, do they tend to pee and wet their pants when they're watching Sesame Street? Like, is that too distracting for them right now that they aren't catching the signs that they need to go to the bathroom? So looking behaviorally at what is kind of causing them to have those accidents, even though you have seen them, go to the bathroom on the toilet. Okay, so this is the phase 3 is the bowel training. Like we said, always check with a medical doctor. You definitely want to review and kind of think about when your child is most likely to have a bowel movement. They definitely happen less at school. So this is something that a school may have a harder time carrying over these strategies. It's something that typically happens at home. And then, if you are using that 20-minute block during those 2 weeks, this might be something like sitting for that long that might actually provoke them to go to the bath, to have a bowel movement on the toilet while they're waiting to pee. So that can be beneficial part of the sitting. Um, and then so you want to look at that data. If they go to the bathroom every day or every other day at 2 o'clock, schedule for them to sit 15 to 20 minutes before you they would potentially be going to the bathroom to kind of get them in there and get them ready for them to go to the bathroom. Um, let's see. Yeah, and then I mean, this is, you really have to gauge it. Some kids are way more consistent than others. My son did have some issues with some, early on with bowel movements, so they were very infrequent, so it was hard for us to track. Um, so, if we had a potential time for him to go to the bathroom, we would never be able to then go back every 5 minutes to go. I mean, that would not work for our lifestyle. So this is something that would be very individual, to you and your family and how it works for your child. Um, some kids have more clear signs as to when they need to go to the bathroom. Some kids go to a certain spot when they're going to go to the bathroom. So if you're paying attention to that, you can catch them before they go to that spot. It is a lot of work. It is not easy. It comes much harder for some kids than others. But these are all strategies you can just work into your routine to create some success for them. Okay. Considerations for bowel training. This can be a lengthy process. There's way less opportunity for rewards because they poop way less frequently than they pee. You would really redo a preference assessment to find out the most motivating item for your child. You may need to shape behavior and get more fun things into the bathroom, like sticker books or whatever your kid is interested in, for them to be able to sit for longer periods of time. You really want to resist putting them back in pull-ups again, unless it is medically necessary, and they've been holding it for a long time. You would want to consult with your pediatrician for that. And then you would do the same positive practice procedures for a BM, other than you wouldn't keep them in the soiled underwear. You would take the underwear off and you would prompt them 3 to 5 times coming back and forth to the bathroom from where they pooped. Like if they were in the living room behind a chair, take them there, prompt them back in the bathroom. We poop on the potty, show them how to do it, and you would repeat those steps 3 to 5 times. Also, sometimes your child's just not ready for this skill. So, urination training is much easier for most people than bowel training. So you really might, after the 2 weeks, if you're really still struggling, it may be something that you need to stop and revisit and kind of determine why they may not be ready. You also have to consider, and this is for all children, life changes, new babies, moving, change in routine, family dynamics, all of those things play a huge factor in potty training, whether it's, sometimes it is for attention, other times they don't even know why they can no longer pee or poop in the toilet. So
I was gonna add to that, Carly. You took the word out of my mouth, but like my son, for instance, we thought we were on a great track. It was about 2 months of like really great consistency, and then he got a new brother, and it wasn't really that he was trying to like pull one over on us. He was just still making that connection of, wait a minute, he's in diapers. I should be in diapers, really kind of figuring out his world that just got flipped. So sometimes those things are a even bigger deal to them than you even realize.
for
So
sure.
just want to add that.
Yeah, yeah, for sure. It can be little things can be really life-changing for kids and can be distracting for them too. And the change of routine for a lot of our students is very difficult. So, okay. I would recommend that book that I suggested at the beginning of the training. These books also, they were helpful for us at our house. It's classic, Everybody Poops. The short and interactive, the Elmo, Potty Time with Elmo. They're able to push the buttons on the side, flush the toilet, wash hands, and then going to the potty was my favorite, my son's favorite with Mr. Rogers. It is very wordy, but it is very thorough, and it's great pictures, and it's kind of it's I would also identify that as kind of a classic. And then I'm going to send this out. If you want additional resources, please let me know. But these are the resources that we recommend and where we've gotten these strategies from, which is Patton. The National Autism Conference had a presentation on toileting that is linked in these slides. We also, years ago, when we were still at one of the elementary schools in my classroom, we held a parent toilet training Zoom with one of the patent consultants. So he talks through all of these things as well. We have a toilet training quick sheet just with some reminders, and then a social story too that we can send to your child's teacher, or we could send directly to you if you wanted to create. And it is just a little story about them using the bathroom that can be interactive and kind of just give them the steps to go through as you know you're going on this journey. So, all right, I think, whoops, it wants me to play those. Okay. So I'm going to stop the recording and then I'll see if our guest here has any questions.
Hey, yeah, no